So what makes a facelift look natural and give you long-lasting results? So in 3 minutes, I'm going to summarize 30 years of facelift experience. So there's 3 principles. Number 1, it's understanding the anatomical changes that happen with age. And this is very important because not every surgeon understands this. There are certain parts of the face that show the gravitational changes of aging, and there are certain parts of the face that, regardless of your age, they do not change. If we draw a line this way, all the tissues that are around here do not migrate down. Everything in front of this line, which is all these tissues, show the gravitational changes with age. And basically what we're seeing is creation of heavy nasolabial folds, development of jowls, and a loose neck. Now, as we get older, the changes get more pronounced. However, it's only this area that we're talking about. So the importance about this is that if your surgeon understands this anatomy, it's not only what gets repositioned to give you a natural result, it's what's left behind that hasn't changed that you should manipulate. Okay, principle number 2, over or under this mass. So the muscles that migrate down with the aging process, again, it's these muscles here in the neck. All these muscles are encased in a connective tissue membrane, and this membrane is called the SMAS. Whenever we do a facelift, we're manipulating the SMAS. There's 2 ways of manipulating the SMAS. We either manipulate it from the surface or from under. When we manipulate from the surface, this is what we call the SMAS facelift. And the limitations of this procedure is that if you manipulate from the surface with any kind of SMAS facelift, you're manipulating or repositioning against tension, which creates 2 problems. You look pulled, number 1, and because you're pulling against tension, results don't last probably more than a year. If you're able to go from under, then you're pulling with no tension, and you're only pulling the structures that have dropped down. So you end up looking natural with no tension, long-lasting results. Under the SMAS is what is commonly known as a deep plane facelift. Third principle is universally, everybody ages differently. However, it's the same structures that drop. So your only question is, when do you want to have an intervention? When these changes are mild to moderate or when they're heavier? But it's the same structures that get addressed. So your job is not really to find a type of facelift, but it's to find an expert and experienced facial plastic surgeon that has a lot of experience with these type of procedures.